The broadcast is now starting. All attendees are in listen-only mode.
Okay.
Are you all able to see my screen?
Yes.
Okay.
All right. Are we okay?
Yeah.
Well,
You are live.
We're good. We're
great.
live.
Hello, good afternoon. Apologies for getting a little bit of a late start. We've had a couple of technical difficulties that took us by surprise, always keeping us on our toes. My name is Jordan Grant. I'm the Policy Unit Manager here at Senior and Disability Services. And we just want to thank you all for joining us today to talk about adult host home care. A couple of things before we begin, just to let you know. GoToMeeting does place all attendees. It does mute their microphones, but we will have time later on if you want to raise your hand and if you'd like your microphone to be unmuted. You're also able to use the chat in the questions box, but we ask that you be really mindful to not include any protected health or personal health information or personally identifiable data, because we are recording this webinar and it will be available later on the policy YouTube page. We have an hour and a half scheduled today. We may or may not use the entire time depending on questions and comments. And without further ado, I would like to introduce Director Newman, who will be presenting today on adult host home care.
Thanks, Jordan. Good afternoon. Welcome, everybody. Tony Newman, Director at Senior and Disability Services in the Alaska Department of Health. And I'm here with actually a variety of staff from SDS. Thanks to them for being here and to all of you for being here today. This is one of several webinars that we are holding this fall regarding changes that are in the works here at SDS and that affect the services that people are receiving through SDS. This is an opportunity to hear from you ahead of the regulatory writing process, a pre-regulatory session to engage with you. Because once we open the regulatory process, the formal process of requesting permission and approval to write a regulation, we are limited in what we can say and how we can engage. So we've been trying to hold these seminars before that period begins so that we can engage in a little bit more back and forth and listening than we're able to once that period starts. So we held 2 webinars last week. We're going to be holding more in the weeks to come. And if you've been participating in these, thank you for coming once again. I was thinking we probably need to establish some kind of rewards program for those of you who come to all the webinars, and then you're entitled to some kind of free gift. But in all seriousness, we are grateful for the turnout these webinars have been getting. The questions have been good. The comments have been respectful, thoughtful, and they've been a wonderful way to hear directly from you and get your input as we move forward with change. So today I am talking about adult host home care, a new concept for Alaska that was placed into Alaska statute just this past year through Senate Bill 57. Cassandra's going to help me switch the slides because of the technical challenges we were having earlier. Thanks, Cassandra. This new program will be administered through the Division of Senior and Disability Services. Here's our mission. Like I said, we've got some people from SDS standing by. Lynn Kyleman-Cruz, our Deputy Director, is here. Jordan Grant, Kat, our Care Coordinator Liaison, Bobby Nave, our new Chief of Quality, and also our partner at the Division of Healthcare Services overseeing residential licensing. Anna Karina Thompson is also here to help us with the conversation. So thanks, Karina, for joining us. Next slide. A little bit more of the housekeeping. Jordan mentioned some of this. This is being recorded. Please don't share private information such as names and health data. The orange arrow gives you the menu for how you can participate through questions. You can chat those, you can type those into the question box, and my colleagues are going to help monitor the chat and question box as we go along. We've set this up so that we should be able to, toward the end, have some verbal back and forth. So after I get through presenting information, and if you prefer to ask your question verbally or make a comment verbally, let let us know through the question box that you'd like to speak, and your mic will be unmuted. And lastly, this is an opportunity to comment. It's not your only opportunity to comment. You can always send us questions or comments at the policy mailbox address listed there. And I'll display that again at the end of the presentation. Yeah, like Jordan said, this webinar might be a bit shorter than the ones that we've been doing, just because there's a lot that's that needs to be determined yet about this new service. But we'll be happy to stay on the phone for as long as the conversation continues today. So this is the front page of Senate Bill 57, which is now a law. It had been working its way through the legislative process for a number of years. The bill became what we call, in those of us who work in the legislative arena, we call a Christmas tree, because although it was initially limited to one subject, as the end of the session approached, other things that people wanted to see pass but didn't look like they could pass through their own bill got attached to this bill. So Senate Bill 57 actually does three main things. The first thing it did, right there on page 1 of the bill, it clarifies that the Department of Health and the Department of Family and Community Services can share information. The Department of Law identified a need for this language following the reorganization of the department into 2 departments, but it really has no impact to those outside the department. So that's all I'm going to say about that. The second thing the bill did was directed the Department of Health to allow legally responsible individuals to provide 1915K community first choice personal care services. This is a bigger deal. It was the subject of a webinar that we put together last week. We recorded that webinar, and you can now see it on our YouTube policy channel if you missed it. So questions, comments about that, I would encourage you to go to the YouTube SDS policy channel and review the webinar. And then adult host homes. The bill directed the department to develop an adult host home care setting and service. I'm going to describe what we know about the service and the setting based on the law that passed, also based on what we know other states are doing with regard to this and about the federal rules. And I'll tell you right up front again, if you have questions for us about how this will work, we might not be able to answer them now, because in some ways this is as new to us as it is to you. And we are going to be spending the next several months laying the groundwork for this service in the setting. So just laying that out for you. This is what we are here for. We would love your thoughts on this as we go along. And if you have questions, even if we can't answer them, it's still helpful for us to hear them, because they know what kind of things people want to know, what people are curious about. All right. Next slide. I want to just pause and note that some of you might have heard about this bill under a different name. It started out, when it began its legislative journey, referred to as adult foster care. That was the term used in the bill. Adult foster care is a service that other states provide. In fact, Oregon has an adult foster care service. Here in Alaska, we started with that name because the bill started out tightly focused on former foster parents who were serving children on waivers who were aging out of the foster care system. And that's why the bill was first brought to the governor's attention. In fact, when he was a state senator, some people who were serving as foster parents to some children on waivers were concerned that as the children aged out of the foster care system, the constituents told the governor there weren't easy ways for them to continue to offer care to these foster children when they became adults, because the only real option available to them was to turn their family home into an assisted living home, which would come with different requirements than they were currently meeting as foster home licensees. So as we developed that option, we were asked, and we asked ourselves, could this service be of potential value to others, not just those aging out of the foster care system? And as we looked at this and thought about how we were frequently asked whether there would be non-habilitative residential types of programs available, we looked to this service that was emerging through this legislation, and talked internally and with legislators about extending the possibility of adult foster care to other individuals with disabilities, including seniors, who would qualify under the Medicaid home and community-based waiver programs. So we looked at it. We looked at how other states do it. Our colleague here at SDS, Jenny Murray, did some research because we asked her, Jenny, find out about how other states provide a residential service like what we're talking about in this bill. And she found it was really difficult thing to research because other states use different terms. Other states' waivers are unique, so it's difficult to compare. But some of the terms for this sort of service she found, adult family living, structured family caregiving, and others I put in gray here. We changed because we were moving away from this idea that it was strictly limited to kids leaving foster care. We changed the name to adult home care. And hearing from stakeholders as the bill was actually getting close to passage, we heard that they thought that a better term would be adult host home care. That would be less confusing with Medicaid home care services like in-home nursing, and they thought that adult host home would be a more appealing name for this service. So we agreed with them. The administration agreed, and in the end, that's what the bill was called: adult host home care offered in an adult host care home. So next slide. It's not a very long bill. It's only about 5 pages long. It real quickly lays out a couple of terms under which adult host home care can be provided. It does so by recognizing the need for rules around adult host home care as both a service and a setting. So like a child foster care is both a service that's delivered to the child, and it's also a place where it happens. So here is, without any sort of interpretation, is exactly what the bill says as far as the service goes. It's to be made available to someone who is enrolled in Medicaid, is on a home and community-based services waiver, is at least 18 years old, has a support plan approved for the host home care service. And finally, the bill says the person in adult host home care may receive habilitative and rehabilitative care in addition to the adult host home care service. That's key, and that's where a lot of thought is need to go, and why we are interested in receiving your input. Next slide. And then there's the setting, and this is what Senate Bill 57 says about the adult host home setting, that it must be licensed by the Department of Health. It will provide 24-hour oversight and care, can serve up to 2 individuals and 3 in special circumstances. We at the division envision that there could be situations, in fact, there have been situations where you have 3 siblings, and if someone was willing and able to keep those family members together, this would be a way to do that. So just to be clear, it's creating a new licensed setting, not an assisted living home. Okay, next slide. You may have noticed in those 2 slides, it says, the bill says what adult host home care will do. It's not really clear on what it actually is. So there is an expectation in the bill that says the department will figure a lot out through regulations. And when I would testify about the bill, I would tell the legislators that what this bill does is provide us with the framework to begin setting up the service. But a lot of this will need to be figured out through regulations. So the bill quite explicitly says that the regs will establish a daily rate for the service, the standards of care for the recipient of the service, the standards under which one would operate an adult host care home, the conditions under which a home could be authorized to care for 3 individuals, not just 1 or 2. And going back to the original purpose of the bill was that the department is charged with setting up a streamlined process for those transitioning from child foster care to adult host home care. Again, not just limited to those leaving child foster care, but doing some work to at least make sure that process is streamlined for those children who are moving into adulthood and leaving foster care. Okay. So what do we envision then for adult host home care? Based on what we know about rules from the Center for Medicare and Medicaid Services, what other states are doing, what we've heard from people who wanted this bill, other input we've received. Here's what we have started to envision here at SDS. That again, it's not an assisted living home, but something different, but also licensed by the department. It's a residential service available to all our waiver types except the ISW waiver, and it's a non-habilitative residential service. Unlike group home habilitation or family home habilitation, which are habilitative, this would be non-habilitative. But habilitative services could be provided, but if they are, they would be provided by a different provider and billed as a separate service. We envision that the provider in an adult host home would help an individual with the activities of daily living or the instrumental activities of daily living, would be there available to provide support and companionship. And again, as the bill says, could receive other services as permitted. Yeah. One thing I want to emphasize, it does not allow for room and board. Medicaid rules are pretty clear. Room and board is not in and of itself a Medicaid reimbursable service or something that is delivered to a person and can be paid for. So room and board would not be something that is paid for under adult host home care. Chore services and home delivered meals. Those are things that we would envision would not be covered, but would be built into the rate for the adult host home care service. No in-home 24-hour other residential services, including a habilitative residential service, would be allowed at the same time, because those would be duplicative for what the individual providing the adult host home service would be providing. Okay, next slide. So what would be allowed under the adult host home? And again, we are not clear entirely on this, because we would need to run by what we have in mind through CMS. But what you see here is the menu of things that could potentially be provided, and that we would need. We would love to hear your input on these things, and we would also be running them by CMS. These other services, we say could, should, would. Again, this is open to your thoughts and your comments, and we're eager to hear them. And just to pause over these, transportation. Is that something that the person operating the home would be expected to provide, or would that be a service that, if approved in the person's support plan, would be allowed separately? Remember, these are all services that the person would have to qualify for. And also an important thing to remember is not all these services are provided in all waivers. So depending on which of the 4 waivers the person is on, that would also dictate whether or not one of these services would be able to be provided. You see, we have limited personal care services on the list. We're not quite sure if CMS would allow personal care to go on at the same time, but maybe in a limited fashion it would. So that's something that we would listen to you if you think that's important. We would pitch it to CMS and see what they would say. So yeah, eager to hear thoughts on these other services that you would envision being provided at the same time in an adult host home. Okay. Thanks, Sandra. Cassandra, you can switch it. All right. So based on what you understand of adult host care, again, this is the service. I've tried to emphasize that it is both a service and a setting that we need to develop. So let's start with the service. Again, this would need to be a certified service for which providers submit an application and documentation that would be reviewed by our provider compliance and certification unit, just like our other certified services. What will the certification requirements be? In the bill's journey through the legislature, when we were asked that question, we would talk about potential ideas, perhaps, for instance, reduced administrator qualifications than are required for our other residential habilitation, for residential habilitation services, for instance. The residential manager, the adult host care provider, would require less experience or a lower education level than the other services, or even residential supported living. Maybe the experience required is not necessarily residential care, but care of other types besides residential care. Maybe someone has provided care in a daycare style setting. Maybe that's the level of experience that someone who would be certified would be expected to have. You know, we would need guidelines of some kind to ensure safety. And we would need guidelines to be explicit about who a person providing this service could use for backup and how, under what sort of circumstances they could use. And then again, as we've been talking about, what other kinds of services should be able to occur while this service is also going on. We would need to work with our Office of Rate Review here at the department to establish that service. I would be asked, you know, roughly what kind of rate would you envision for this service? And we would not throw out a number necessarily or anything like that, but with the idea being that this is a lower level of expectation than a habilitative service, would come an understanding that would reimburse less than one of our residential habilitation services, like group home or family home habilitation. Another consideration that we're weighing here at the department is that we could allow this service to be offered by individuals and homeowners that could be assisted by an administrative organization known formally in CMS world as an organized healthcare delivery system. If you've been following our long-running conversation about our efforts to clarify the difference between group home and family home habilitation, you've heard us talk about the organized healthcare delivery system, also known as an OHCDS. In a nutshell, an OHCDS sets up a contract with a rendering provider, that is the provider who is actually providing the service. And the administrative body, the OHCDS, assists with things like submitting Medicaid claims, meeting certification requirements, and keeping up with compliance. So we are working on that concept. We are going to hold a webinar about it in November. But whether or not the adult host home care service could participate and take advantage of that concept is something that we're thinking about. So look out for that webinar. I think we're planning to hold it in November. Okay, next slide. And then the other considerations are around the setting itself, the adult host care home setting. That would be a licensed setting, licensed by the residential licensing section at the Division of Healthcare Services. And again, they're here, and Karina Thompson is their unit manager, the section manager. She's here and can help participate in this part of the conversation with us. But in a nutshell, we need to determine what the licensure requirements would be. Again, as the bill made its way through the legislature and we got questions about it in hearings, we would talk about the ways that we might be able to change, lighten, adjust the requirements that are currently needed for assisted living and how they would be different for this kind of setting. For instance, one of the things we talked about that for an assisted living home license, a 3-month reserve requirement, 3 months of funding reserves is expected. Maybe we could change that for adult host care homes. Maybe we can reduce the administrator qualifications that are required under residential licensing for assisted living, such as the requirement that there be a degree, that the administrator have a degree, depending on whether someone is being licensed to serve seniors or individuals with disabilities. There's a nominal, small, but there is a licensing fee. There's a fee to become licensed in assisted living home. Maybe that could not be a requirement for the adult host care home. Maybe there could be flexibility on some of the physical plan expectations, like square footage requirements compared with assisted living homes. Again, some of the ideas we've talked about, nothing's written in stone because we're in this pre-regulatory process. So this is your opportunity to tell us what you think about requirements that would be needed. And another important consideration, next slide, Cassandra, is what are the safeguards that would need to be in place to protect individuals and providers who offer this service and receive this service. An individual would be living in someone's private home. So what are the sorts of things that we would expect that they have the right to would providers be considered mandatory reporters for adult protective services as caregivers of vulnerable adults? These are the kinds of questions that we'll need to ask, and we'll want to make sure are as explicit as possible in regulations. Okay, so next steps. We are going to continue to accept stakeholder engagement for another month. October 27th, we are going to plan on beginning the official work where we make a request to the commissioner's office here to begin work on the regulatory process. And like I said earlier, puts us on that track to begin the process, begin public comment, have a public comment period, a public comment hearing. But again, this is the more informal time right now, and we want to really invite you to participate, to send us your thoughts, to contact us and ask questions and give us your comments. This also would require approval from CMS to add adult host home services to our waivers. So the state regulations need to be developed. The waiver amendments need to be developed. Typically, we like to have those happen at the same time so that they arrive complete and ready to go at the same time. The waivers are approved. The regulations are approved. So we are doing that, working toward an implementation date of July 1st of next year, if all goes well, as it states there. Okay, so I've been talking a lot. I'm gonna end my formal presentation there, and see Jordan, if there are questions or comments that have been in the chat, if you would share those with us and start a little bit of dialogue, and then after we exhaust those, we'll see if we can bring people off mic if they'd like.
Sounds good. Thank you so much. So I just want to start off by letting everyone know that everything you've put in the questions box, we do have saved, and it actually is saved in GoToMeeting, so none of that is gone. We have all of that, and then I'm going to sort of paraphrase some of the questions. Oh, looks like we're seeing a different screen there for a second. I'm going to paraphrase some of the questions. So if your exact question isn't isn't read out exactly as you typed it, don't worry. We have it as it was written also, and we're going to keep that and look at that also. But it probably means a couple people had that same question or comment. And then the other thing I wanted to mention is that this is as Tony mentioned, a brand new service and setting and license type for us. So we may not have answers to the questions, but we are so happy to have you ask them because it helps us think through what we need to consider. So we may not have a good answer. We're still sort of figuring it out, but we want to hear from you and hear what ideas you have. And maybe those are questions and maybe those are comments. And you're also welcome to send those to the policy email box, which is in the chat and also on this screen. So the first question we have gotten a few of are whether this service would be available to adults who are not transitioning out of foster care.
Yes, and thank you. It would be. That's a fine question because the bill started out being limited to people transitioning out of foster care. But again, as the bill now states, it's really the only stipulations that were placed into the law were that it be available to adults. So it's adult host home care over 18 on a Medicaid waiver and has a support plan that's approved for adult host home care service. And as with all of our waivers, Medicaid eligibility is a requirement.
Thank you. And then we are also getting a lot of questions about what other services could be provided. People in particular are wondering, could eMods be provided? What about respite? Questions around limited PCS services. And then a question maybe to sort of tie all those together. I know we had done some research about what other states were doing, and there's a question about what other states allow, what other services other states allow.
Mm-hmm. Yeah, and again, great questions. I think the primary consideration we have is that we need to be careful about the duplication. Once we define what the service is expected to offer, then we can look at what other services will be permitted to be offered at the same time. So I would imagine that we would have quite a menu of services available, but I hesitate to speculate too much on what they would be exactly. If you know, I would love to hear people's reasoning for why they think it's particularly important for eMods to be made available. eMods right now are limited to individual homes, people's own homes. So to offer eMods under a licensed setting, that would be something we would have to explore and see if we can get permission to do. So yeah, so again, it was really valuable for us to hear if you've got a question and you're asking because you think it would be important for a particular service to be provided in that setting, that would be really important and valuable for us to hear.
Absolutely, we definitely welcome those, both in the questions box or through email. If you have a service you feel really strongly about, go ahead and let us know. We would love to hear that. Our next question is about adults who have an OPA guardian assigned. Would they be able to receive this service?
Yeah, I don't know any reason why they wouldn't. Many of our recipients have assigned OPA guardians. So
bear with me as I'm looking through this. Would the adult host care homes have a minimum amount of direct support professionals on staff at all times?
So, you know, good question. The way I think we're envisioning this here at the department, and any of my colleagues here at SDS I welcome to join in on the conversation, is that this is very, very similar to family home habilitation in that it's a live-in caregiver who's expected to provide the 24/7 service. So I am not imagining that we would be there'd be an expectation for additional DSPs working in the home, aside from maybe sort of the more time limited sort of things like they have. Lynn, do you have a further thought?
No, that's exactly it, Tony. You captured it very well. I think this is a host service, so it's not intended to be able to hire other staff. And we still have to decide, that's part of the reason to bring this out to you right now, is we still have to decide what other services make sense. We're thinking of it more like a natural home environment, but obviously we're paying for a little bit more support. So what types of services go into a natural environment, and that person providing the support, should they be able to deliver any of that care? In our minds, we say not really, except for the host home service. But that's something we'd love to hear from you about.
Yeah, one question that came to me over the bills being worked through the legislature was, well, why is this going to replace family home habilitation? And the answer to that is no. We have no intention of dropping family home habilitation. They're different services. This is a non-habilitative service. Family home habilitation is a habilitative service. It is similar in many ways, though, isn't it? A live-in caregiver, but not expected to provide the help in helping people keep or improve their self-help and social skills the way family home habilitation is.
Yeah, they're providing the help, but they're not teaching. There's no teaching or habilitation required in this service. So it's really providing some of those activities of daily living and independent activities of daily living, like the host home may shop for the person if they're unable to do that for themselves. They may help them, assist them in the bathroom, but they're not teaching them independent skills through the service, if that makes sense.
We're going to be really eager to see how people respond to the availability of the service. Will it be a particularly valuable service in rural Alaska, where the assisted living sort of options are limited, and it might be more difficult to meet the expectations around establishing an assisted living home? We've heard over the years that people would like an option for more non-habilitative care. The challenges of trying to meet habilitative goals are onerous to some, and so this is a non-habilitative service that hopefully meets some people at a better place. And the idea is more options, not to take any away or replace any at this time.
Thank you. We do have a couple of questions kind of along the same line. How is this different than small assisted living homes that already exist?
Yeah, that's a good question in line with what we're talking about. The idea is that assisted living homes for SDS services, at least, are for habilitative services, and this would be a non-habilitative service. And like we also talked about earlier, the idea being, let's find some ways to change or lighten or adjust the expectations around assisted living for a home of this type.
Thank you. We also have a couple of requests. If we could just repeat what waivers would be eligible for this.
Yeah, it's all the waivers except the individualized supports waiver, the ISW waiver. So that would be adults who participate in the Alaskans Living Independently waiver, the adults with physical and developmental disabilities waiver, the IDD waiver, the intellectual and developmental disabilities waiver, and also the CCMC waiver, right? Because an adult is, for the purposes of this bill, is anyone over 18. There are a few years where someone on the children with complex medical conditions, I believe up to the 22nd birthday, can continue to participate in that waiver. Am I right about that birth date, Lynn? You know? No?
I'm sorry. I was reading a question.
No,
ask
just
a
that
question?
I was saying that there could be people eligible for the CCMC waiver who are over 18 and are still haven't aged out of that waiver.
Yes, they get that up to the age of 22. Mhm.
Now we are getting a bunch of questions about whether individuals who are LRIs would be able to provide this service.
Well, that's a great question, and it makes sense that you would ask that. There's been a lot of confusion around how this bill was inclusive of the legally responsible individuals providing 1915K personal care services, but they're unrelated. And right now, we are moving on a different track for adult host homes. The only waiver service right now that we are entertaining moving forward on allowing legally responsible individuals to receive are in-home supports and supported living. So again, we're not entertaining that question right now. Yeah, so I don't have anything more to add really. It's just that we're not really moving forward on legally responsible individuals being able to provide this particular service.
Thank you. We do have a couple of comments, I think, about what would be required for someone who would like to provide adult host home care. So yes, they should be a mandatory reporter. It would be nice to have first aid and CPR, CIR training, and a few others, but too many barriers, it will be too many requirements would be a barrier. And then also the comment we would like to encourage families and others to provide these safe homes for community members who need it. So some positive comments in the questions about this service being off to a good start, and about particularly that it would be available to individuals on the ALI waiver.
I saw another one in there, Jordan, about whether someone said, wouldn't assistance with activities of daily living and independent activities of daily living be a duplication of personal care? And that is exactly the type of question that we need to ponder and contemplate, because we do believe we have to request this service from Centers for Medicare and Medicaid. And that is part of always our consideration is what would be considered duplication. Would there be an instance where the host home would provide some of that care, but there might be additional things that would be warranted for personal care? Those are the kinds of situations that we need to hear about so that we can articulate that to our federal partners, or make a case for it, or make a case against it. Great question. We don't have the answers to that. To us, it seems a little bit duplicative, but that is definitely something that we would love to hear from you about.
Yeah, and that's why in our slide earlier we talked about maybe the possibility of some limited personal care services, right? So we did note that our vision would be that they would be able to provide some of the assistance with those activities of daily living, but could we supplement that with a little bit more support to make it a more wouldn't that be a more enticing service if you know you were going to be able to get a little bit of that support to offer an individual than being expected to do it all yourself? So yeah, good question, and one we're going to be exploring.
Then we are receiving quite a few questions about room and board, and I think there was a mention of that earlier. If we can comment a little bit more on how that would work.
Mm-hmm.
I can start if you want, Tony.
You bet.
So as a Medicaid service, the Centers for Medicare and Medicaid does not allow room and board to be included in the service itself. So what we're talking about today is just the service, which cannot include room and board. Room and board typically occurs between the license setting and the individual or the individual's family guardian. And that would be the same for this particular service. We can't include room and board in this.
Yeah, like Lynn said, that's it's been interesting. I've been learning a lot about room and board over the past several months, and learning that is, like Lynn said, that's an agreement between the provider and the recipient of the service themselves. Bobby Nave, our new chief of quality, who comes from residential licensing, has pointed out to me that the regulations on room and board state that they need to have a contract, right? The provider needs to have a contract where they are explicit about anything they're going to charge the individual residing in the home, but they don't say what those charges should be. They don't say how much they should be. It's just only that it has to be transparent for the recipient, that they know what other charges above and beyond the service they're receiving are. Did you have something to add, Bobby?
Nope, I was just gonna say, yeah, you're 100% correct. It'd be something that would be spelled out in a residential service contract between the provider and the resident.
And Bobby, on that point, would you imagine? And again, we're all kind of groping around in the dark, but would you expect that the adult host home would also come with a contract between the individual and the provider? Is that something that we would probably see continue, or be like an assisted living home license?
Yeah, I foresee it being very similar to residential service contracts that are required of residential licensing. It may be a little less descriptive in regards to the services that are required of that particular provider, just because of maybe some of the lower settings requirements. But yes, we would expect to still, I foresee that there'd have to be some sort of contract between the provider and the resident, spelling out what actual services are going to be provided, and what fees are being charged for those services, to include room and board, if that's what they're looking to charge that individual.
I did see some comments about what safeguards, what are we going to put in place to keep people safe? I have a really tiny little question box, so I'm like trying to look at it and answer those questions. But what are the safeguards we're going to put in place? That is one of the safeguards, so that a home couldn't then move someone in and then make the rate be $1,000 a month when the person can only afford $200, so that you agree upon those things before you move in. That's one of the safeguards that we probably would want to see. But I guess the people that are asking us the questions, we don't have all the answers. So what are the safeguards you think we should put in place? I know that we've heard, through the public comment time, through, the legislative session, that people were a little concerned that, licensing is one of the entities that go out and have, inspections of licensed facilities. So how do we ensure that people are cared for and that there's integrity in the home for the person that's actually delivering this type of service? Those are great questions. We'd love to hear from you about those.
Okay, we have another question here about if we could clarify if others living in the home can be on the waiver, or I've had a few situations where they've aged out of FAMHAB but cannot remain in the current home. Could a FAMHAB home also be an adult host home for a specific individual?
At the same time, you mean, are they asking, could you have somebody in FAMHAB at the same time that somebody is also in the same home on this host home service?
I think we could answer that, and also if we could maybe speak a little bit more about the intention to make the transition easy if someone needed to transition from FAMHAB to adult host home.
Well, I think those are good questions. As far as the transition goes, maybe that's something that would be valuable to, I don't know, spell out in regulation. I'm not sure. We don't do that for someone transitioning between FAMHAB and group home, for instance, do we, Lynn? Yeah.
We try not to, because it's a very distinct service. It's a much different service. In these particular homes, we're thinking that it's limited to the number of people, so that might not happen very often, but it's a good question to think about.
With a comment here that as the home care provider ages, they may need to do someone to do the heavy PCA for their client, just a consideration. Yeah. Let's see, I'm going down the list.
I see a lot about legally responsible individuals being allowed to provide this care. And I think it's really important to point out that the rules for legally responsible individuals are, we're still wading through that. I think Tony already talked about that, and we're dipping a toe in it with one service that's in our waivers. So when other states say they're using it under their waivers, they're talking about self-directed personal care or some other type of service. So at this point in time, I don't think that we have the bandwidth to explore all the rules around that. We're just trying with in-home supports and supported living. Very, very, and we're not sure if CMS will approve that. We're going through the hoops and trying to make it happen, but I just wanted to sort of address that head on here. So it wouldn't be in this go round, I think.
We also have a question here about who drives the determination of whether host home is chosen over group home or FAMHAB. So three options are available.
Who drives
The
that
person.
decision? The person,
Right,
yeah.
the consumer choice.
The individual receiving the service should always drive the service for any service that we provide.
We also have a clarifying question here of would the individual receiving the service live in the host home alone, or would a person live with them?
Say again?
There might be a little confusion about the host home. Would the individual live in the host home alone, or would a person live there with them?
Yeah, the provider would be the one living with the person, and there could be up to 2 residents in the home, and even 3 if the particular conditions apply.
The person that is the host is the person delivering the service. So it would be their own home, the host's home that the individual would move into.
I have a question here about whether PCS services are authorized in children's foster homes right now.
My understanding is that there is a reg that allows children in foster care to receive, and in a participating in the waiver to receive some personal care services. So yeah, I believe that regulation does exist.
It's very limited, I would say, because of children. There's a duty to care for children that you don't have with adults, and so there's a limited amount that happens, but it is allowed.
Yeah, and then along with that, a recommendation to establish a reimbursement rate that either matches or is slightly higher than the children's foster care rate, so that providers wouldn't choose a different service category that might have higher rates.
Mm-hmm. Mm-hmm. That's an important thought.
This is another question about the host home setup. So for potentially for seniors, would it be possible for a host home to be one that the waiver recipient owns and is converted into a host home through the addition and oversight of a professional care person on site?
Was that a question or a comment?
Just I think a comment, just sharing some of the comments we have here. One of the suggestions for safeguards would be periodic random inspections, and then a question about what safeguards already exist for assisted living homes, and if those would be the same safeguards for adult host home.
Well, yeah, I mean, safeguards already exist, and that's a lot of that work is done by residential licensing, but also by SDS in terms of quality assurance oversight for the services that are delivered in them. And there would be processes that mirror those in the development of this new license type and service.
Thank you. And then we also have recommendations to keep things simple, as the original intent was to simplify the transition process. So just a request to keep things simple if possible. Let me see, I'm reading through.
Jordan, as you look at those, I just wanted to emphasize again that you know, I tossed out some ideas about possible reduced administrative burdens, possible reduced burdens for both the settings requirements and the service requirements. And again, just ideas at this point. We are taking advantage of the fact we haven't started writing regulations yet, and just wanted to throw some ideas out there. But nothing is written in stone at this point. So you know, the idea that there would be lower administrative or square footage requirement, anything like that, just thoughts that we're having, eager to hear from you, but by no means are necessarily a for sure thing.
We are getting a lot of comments though, which is awesome. I mean, there are a lot of comments in here. I am very impressed. It feels good. I like to see it.
We do have a couple of questions about licensing regarding what situations maybe would allow 3 residents to be considered. If we have any provider feedback or anyone has any thoughts on that.
I can speak to the fact that when we just from when we were trying to think about the service, when you go to 3 residents, and I think that's probably why Karina came on. When you go to 3 residents, it gets a little bit more complicated, at least in Anchorage for sprinkler systems. It also raises the bar for, if you're just a host home, how much care you can actually provide 3 different people. So it's just a consideration that we've made. But Karina, were you going to say the same or similar thing?
No, yes, Lynn, I was going to say something similar in that also we are just in the initial process of reviewing, you know, the bill or the drafting the regulations. So we're still considering the options, but like you mentioned, here in the municipality, especially the fire sprinkler system requirement likely would be, you know, still in place. And even in the Matsu area now, they are requiring a plan review there. So, you know, in the future, they may also require a sprinkler system for 3 or more, but that's not up yet, but at least they are requiring a plan review. So yeah, we're still in the initial process, and we'll evaluate, you know, and we will communicate when this is having established, how you can get licensed for 3.
Thanks for joining us, Anna, Karina.
Oh, you're welcome. And can I clarify, or not clarify, but just state one thing. We're also reviewing the part about the fees. It's not set, you know, the fee that will be required for this new type of license. Residential licensing is evaluated with healthcare services upper management, and of course, when we have a decision, we will inform everybody about the fees, like Tony was mentioning, maybe the square foot requirement for the bedrooms. All that is in, we are reviewing, we are discussing, and then we're working to, you know, have a draft of the requirements and the regulations.
Thanks, Karina. Yeah, yeah, just can't emphasize that enough. These are just ideas that are that we've thought about. What ways could we make this an enticing service that people want to offer, and we have lots of constituencies we have to make, we have to satisfy to make any changes, though.
There's a few questions about service notes as well, and that's always a little bit of a tricky one too, because, you know, as the saying goes, if you don't document it, it didn't happen, kind of thing. CMS, when they're paying for the service, they're going to ask us, how do you know the service was delivered? How do you know the person was in the home? How do you know that you know, their needs were met while they were in the home? Those are all questions that we can't answer on our own. We have to look at documentation. So open to hear what people think about how to change documentation. I don't know of a way around documenting that the service occurred in the home. That is pretty basic for CMS requirements. And they do pay for 50% of this service. So
they have a
thoughts.
significant say in how it's going to work.
Yes, they do. Mhm.
Thank you, Lynn. I just want to do a quick time check. We're at 1:05 right now. I think we're going to keep taking questions in the questions box until about 1:10, and then around 1:15 we will start to see if anyone would like to have their mic unmuted. So if you have any last minute questions, please pop them in the chat. We are getting a lot of questions about sprinkler systems. So will the muni allow these homes not to meet the sprinkler requirement? Other comments saying the home should not be required to have sprinklers, but there should be other fire safety requirements.
No, we appreciate that. Lynn and I just met with a provider this morning who was asking the question about sprinkler system requirements, and as Anna Karina made clear, we have that's really a municipality decision, and that's where concerns and questions about that need to be directed.
And we have a couple other questions also encouraging perhaps more information from other states that have established this setting and care level, and see if that information could be made available to stakeholders too. They'd be interested in seeing that.
Yeah, you know, again, there is lots of good information out there. In some places, this is a new setting. We had a conversation with Washington State a couple of months ago about the service they're establishing. As I recall, it was called Companion Home Services or something similar to that. And they were still ramping it up. They had just a few providers, and they were still trying to ramp it up. And the challenge, of course, is that every state's waivers are approved separately. They are unique, and it gets really challenging to compare, to compare us to Alaska to other places, and say that we want to offer a service in exactly the same way.
Thank you. And we also have a recommendation that we update the COPS for residential services to be very specific about what services are included and what services are related to the difference in rates. Maybe it would help differentiate this new service and residential supported living from having group home, and would also provide some guardrails. So just a comment, a suggestion there. And let's see. We do have a couple more comments on documentation, wondering if there is potentially a state portal for non-habilitative documentation, and then also a suggestion that they enter a note at the end of the day like a social worker does for a skilled nursing facility. There's some more comments on documentation. We have a comment that says, it sounds like a FAMHAB home, but with fewer requirements. So if the rate decided on this for the reason is higher than that, then rates should be increased for FAMHAB also. Let's see if there's any last few questions we should get. We have a comment saying the actual home may not be ADA compliant, but maybe the bathroom isn't big enough for a wheelchair, but if the recipient doesn't need a wheelchair, then it shouldn't matter. Comments about licensing requirements. Sorry, bear with me. The chat it's so wonderful to have so many questions in here, but I just want to make sure we got most of the themes we're seeing, and I think we did. So at this point, if you would like to have your mic unmuted, we'd ask you to see that top orange arrow. It's an orange box with a white arrow. If you want to open that, you should have something that says you can raise your hand. And if you raise your hand, we will unmute you and you can share your question or comment. We'll give people a moment to do that.
Jordan, thank you for monitoring the questions. I've been unable to see them. I think my panelist privileges went away, so I really appreciate you sort of moderating.
Right, yeah, of course. So we do have a question from Zachary J. Zachary, we're going to unmute you. And Zachary, you may have to
I'm muted. There we go.
Okay, there you go.
I figured it out. It gave me some warning things. Thank you. I'll start over. It sounds like folks that are on IDD waiver or ALI waiver would be eligible for the adult host home, but they were asking for less from the adult host home. So then in my mind, then it's tailored to folks that might require less supports than an IDD home or an ALI home. So is the only way to qualify for an adult host home by already being on those waivers, or is there also an intention to make a waiver exclusively for the adult host home so we can make this available for those folks that fall in the gaps, like somebody who gets a TBI after the age of 22, doesn't have the physical limitations, and then doesn't qualify for IDD, doesn't qualify for ALI, but would really benefit from being in somebody's home and having those 24/7 supports, but doesn't qualify for any of these other waivers. So if we're asking for less from the home, is there a new waiver that will exist to help these folks that fall in the gaps be eligible for this service and only this service? Yeah, that's my question. Sorry, I got a little.
That's a great, Zachary, thank you. That's a great question. Right now, it is only limited to the waivers. We don't have a mechanism right now to provide the service through people that wouldn't be on the waiver. But I really appreciate the question, because I have heard from many people that we need to figure out ways to better serve people who do not rise to the level of need that is afforded through waiver services, like people with early dementia, for instance. So right now, the service that we'd be developing would be limited to those on the waiver, but it's a really intriguing idea, and I appreciate the question.
Yeah, I think one of the things, just to add a little bit to that, is one of the things we're always looking for is what we can do within our existing authorities from the federal government. So under the 1915C authority, which is where we have all of our Medicaid waivers, we are able to add this type of service and have it be funded, partially by the federal government. So the question really is, how do you build out a service for all those other individuals that might need this same kind of housing option without having them meet that 1915C authority? So that takes a bit more work to figure that out, and maybe we don't have those answers today for sure, but it is a really good question.
Yeah, thanks, Lynn. I like the question. It's almost is the seed for another idea, and maybe a way to begin addressing that need. I don't know, but I think it's a great question.
Okay. Well, thank you for taking it, and just for, since this is open for feedback, that's the biggest thing. I'm a public guardian in Fairbanks, and one of the biggest the parts of my population that are just very difficult to serve because they are not able to thrive on their own, and they're just short of all the existing waivers, and maybe don't need the extent of what's offered under those waivers. So as we were talking about something with a lower barrier for the folks actually providing the service, I was hopeful that it would be something that would be more accessible to these folks. But I know in other parts of the state there's through the general relief, there's homes that kind of tailor to these populations, but in Fairbanks, it's real bleak. If you're not on IDD or ALI, you're not in, you don't have supports. So that's, at least in my part of the state, a huge part that's lacking. My folks with mental health, early onset dementia, folks that have the memory issues, but not the physical limitations, TBIs that happen after 22. And there's not a lot of in-home service providers in our town, so it's pretty bleak. So anyway, throwing it out there. Thank you so much for so much of your time. I appreciate it.
Yeah, and thank you for your work.
Mm-hmm. Yes.
Thank you, Zachary. Well, if anyone would also like to have their mic unmuted, go ahead and raise your hand. But in the meantime, we did have another question roll into the chat asking us to address medication management and how that would work in an adult host home.
Yeah, medication management is a tough one, and if there's one thing I feel like I've learned is that it's really difficult to establish overarching rules around how medication should be administered, because it just is so unique to the individual. So I think, and Bobby and Lynn, correct me if I'm wrong, but I think we kind of need to continue with that idea, is that what is the individual capable of? What does the individual need? What is the provider capable of? What kind of medical support do they have available to them? Yeah, anything else?
No, I think you're right on. I think it's going to very closely mirror what currently occurs in assisted living homes. You know, if an individual is capable of administering their own medication, then they would be allowed to do that. But if they require medication administration, you know, those rules are, you know, put in place, and not only from residential licensing regulation, but also, you know, nursing regulation. If you have to administer medication, there are certain trainings you have to take and certain requirements that fall underneath those requirements. So it'd be a very closely mirror. At least I would foresee it, and Karina, you can jump on and correct me if I'm wrong, but I would, you know, see it very closely mirroring what's currently required in the assisted living homes for medication administration and management.
And self-administration training through SDS requires that as well, for people to have self-administration policies about how they're going to assist someone to self-administer their medications. And there are really very clear nursing delegation, you know, requirements that we have to follow.
Yes, and thank you, Bobby and Lynn. And yes, as I mentioned before, residential licensing is going to be reviewing all those requirements. Most likely, we will still have the requirements for medication administration, training, and self-administration, you know, training for the providers, caregivers.
Okay, I'm looking through to see. I thought we saw Michelle G. Was your hand up? Do you still have a question? It looks like your hand is back. We're going to go ahead and unmute.
I was just going to add one quick thing, Jordan, while you do that, about medication administration. I see some things in the chat about medication, self-administration, documentation of medication. I think that those things will all be really important, because we always want to make sure we're tracking how meds are being delivered and who's receiving their medications and who might not be receiving their medications. And that is probably one of our always like an area of concern for us. And so we will have to carefully consider that. But go ahead, sorry.
Thank you. Like, we have Michelle G. Michelle?
Hi, it's Michelle Giroux from Hope. Just a couple comments. I think, you know, this original bill introduction was from the governor trying to reduce administrative burdens for foster care providers that wanted to keep the minors in their home as they were transitioning to adulthood, so that they had a continuity of family, a sense of family. And then that expanded to include potential elders. And I think it does give the option for those people who are maybe aging in the disability space, who don't want to be habilitated anymore, that more like the companion services that we've talked about, as opposed to rehabilitation. I just need support. I don't necessarily need to be formally taught. I just need to be walked alongside and given support. So as this gets developed, just want to assure or have some assurances that we're thinking about not having the same administrative burden move from this category to this category with different rate disparities, because it was my question about who determines the category. And an individual may say, I don't want to be habilitated. But if a provider is looking this as a formal job, they're going to look at the rates and try to influence the level of care based on the rate of reimbursement, as opposed to what potentially the individual really needs. So I think collectively we all need to be very alert to that and giving people choice and opportunity to say, I just need support, and I want safety and I want security. So obviously there needs to be some expectations for that. But I'm concerned that we put too many administrative burdens, shift a rate down, and it will just drive people back to group home service rather than having this be a robust opportunity. Although hopefully in rural Alaska, it will give more opportunity and flexibility for family members who are currently supporting loved ones to perhaps continue to do that and have some income on the side. So to keep that family unit intact. So that's just some comments along the way, but appreciate the opportunity to hear and to be thinking about how we can give better feedback to help you develop this program.
Michelle, thank you so much. And I wanted to just say thank you for your participation in the development of this bill over the past couple of years. I know whether it was through your work through Key Coalition or representing Hope itself, that you were there to testify and ask questions all along the way. So thank you for that. Thank you for these comments.
You're welcome.
Thank you, Michelle. Next, with their hand raised, we're going to unmute Heather P.
Hi there.
Oh, yeah, great.
Just a quick question. I haven't heard anyone mention a long-term care waiver, and if that would work with this particular new service, or if that is with something else, because I'm, thinking more, what about people taking care of their elder parents?
So wondering, Heather, about the possibility of developing a new waiver. Is that kind of what you're wondering?
Well, the adult host home care, does that, work with caring for your adult parents in your home?
Gotcha. Yeah, we are anticipating that Alaskans living independently waiver would be eligible for participation in this. The question about whether adult children could care for adult parents through this, I think would make sense, as long as we're not straying into that legally responsible individual being the one who's deciding what services the person needs, and making sure that roles are clear and responsibilities are well defined.
Right, like
yes.
if they have a care coordinator and you come up and everybody's planning the plan of care, yeah. Right, and okay, thank you.
Yeah, that was one of the considerations that went into thinking, could this be of service beyond just merely people who are leaving foster care, was a possibility for people to remain in their communities, especially elderly Alaskans.
And I see some questions, or saw some questions in the chat or in the question and answer box about, could a power of attorney provide the service? Could a legally responsible individual provide the service? We're looking for sort of feedback on conflicts of interest. So sometimes, even if it's not the legally responsible individual, we also have to care for conflicts of interest. So if I'm the power of attorney for someone, and I'm trying to sort of push them into my care so that I can, receive reimbursement for it, we want to be just cautious of that and careful about that as we go forward. So if you're a guardian or you're a power of attorney, those are the things we have to consider, are those conflicts of interest. So we'll have to write some rules regarding that and welcome your feedback about those.
Yeah, thanks, Lynn. Thanks, Lynn. That's really, in a nutshell, what it's all about with regard to these questions about legally responsible individuals, guardians, family members, avoiding conflicts of interest, and making sure that the individual is really retaining their choices, the right to make their choices on their terms.
Thank you, Tony. Denise, we thought we saw your hand up. Did you want to have your mic unmuted?
I didn't hear you.
Oh, sorry. Did you want to share something?
Did you say Denise?
Yes. Yeah.
Me? Okay, sure.
Sorry.
Yeah.
We thought you saw.
Okay, sorry. Yeah, I put it down because I really was going to mention what she's last two people said. I guess I just want to say that if the rate is going to be what assisted living home rates are, then we need to have similar kind of things around that. But my worry is, because I see this as such an awesome thing for families who want to care for their loved ones in their home. I've really never met anyone who said, I can't wait to get sick or ill enough to go to assisted living. So I see this as an opportunity for maybe a family member, a child or something to open their home to their family member. But I don't want to see it where the regulations for certification and licensing are just so complicated. Right now, if you're assisted living, you have all the those, it's just a lot. I've worked with a lot of assisted living homes. And so I wonder if the rate isn't as high, but they have those same needs, can they have those other services? Like say you have a 2-person support need for certain things that you do, so you can have some extra staff in there. Somebody's awake staff at night because the elder's up all night long and nobody can even work during the day or even with them because they need to be sleeping because they were up all night with them. So I just look at kind of the population I think of with the elders with dementia, and most of them move out of their home when they start being awake at night because the families have to, work. Maybe they go to daycare during the day and they're keeping them fine, but then it just kind of increases this need. So that's my caution, but I think I'll put it in the email to you guys and put that in, my comments to you. But that would be just my biggest fear on this, is that it just became more like a regular waiver, more like a regular assisted living home. And the families looked at the list of what to do and said, there's just no way. It's just too complicated for me. And, and maybe it needs to be that way in the end. I don't know, but I would like to, she mentioned earlier, make this not too cumbersome for families who might want to do it for loved ones. Thank you.
Yeah, thank you so much. Denise, that is the hope, that we can find ways to make the administrative burden lower, to make it more appealing for people to offer. So I appreciate those comments, and that is our goal. We're always pushing up against what our federal partners, what other sort of requirements we have to meet. And
right. Thank you.
Yeah.
All right. Well, we have 3 minutes left on the clock. So if we have any last minute hands up that would like to be unmuted, I will go ahead and unmute you. I'm just scrolling through right now. So stick them up if you would like to be unmuted. I am not seeing anyone yet. And if not, we can go ahead and wrap up. So thank you so much for joining us today. We appreciate all of your comments. Again, all the comments we have in the questions box are recorded, and we will be reviewing those for consideration. I appreciate it so much. As we've mentioned before, please, if you have other thoughts you'd like to share with us, please send us the email to the policy email, which is in the chat, and also on the slide here, where we'd be thrilled to hear from you. So with that, I hope everyone has a good rest of the day, and thanks for joining us.
Thank you, Jordan. Thanks, everyone.
Thank you.